on ulcerative colitis, which affects the colon and rectum. Treatment of ulcerative colitis may vary depending on where the disease is mainly located. This may be limited to the rectum, proctitis, involve the rectosigmoid colon, proctosigmoiditis, or the descending colon up to the splenic flexure, left-sided colitis. These areas of involvement are collectively called distal colitis or distal disease. If the whole of the colon is affected, this is called pancolitis. This involves the entire colon, extending from the rectum to the start of the small intestine. About 40 to 60% of patients suffer from proctosigmoiditis, 20 to 30% from left-sided colitis, and 15 to 20% from pancolitis. Treatment options include oral therapy, tablets or granules, and rectal therapy, foam and liquid enemas and suppositories, depending on where the disease occurs. If there is pancolitis, the inflammation extends beyond the reach of enemas alone, and an oral therapy will be required on its own or in combination with rectal therapy. The bloody diarrhea and unpleasant symptoms associated with ulcerative colitis are a result of the inflammation the disease causes. The aim of treatment is to control this inflammation and reduce the symptoms. Treating distal disease locally and quickly is important, as it's believed that reducing inflammation quickly may prevent the disease becoming more extensive. Rectal treatment in the form of foam or liquid enemas and suppositories is therefore very common for many patients as they try to control local inflammation in distal disease. The choice of which rectal treatment to use, foam or liquid enemas or suppository, will be made depending on where the disease is located and in discussion with the patient regarding personal preference. There are two current classes of drugs for disease located in the distal area. Based on available evidence, the British Society of Gastroenterology and European ECHO guidelines recommend the use of mesalazine as a first choice. However, if a response is not seen to occur with the chosen rectal treatment within an agreed time and the symptoms are not well controlled, rectal steroids may be considered as an alternative or additional treatment. To control the disease, maintain the effect, and delay progression, it's important to remember to take the treatment prescribed on a regular basis, even if the symptoms are improving. Evidence is clear that not maintaining the treatment for ulcerative colitis does lead to a 5-fold risk of recurrence of the disease.